Hi friends, welcome to classes by Lab Doctor. In today's class, let us study about the symptoms of high cholesterol. We all know that when the cholesterol level goes beyond a certain range, that is when it becomes dangerous and causes certain symptoms and complications. So, for a healthy heart, we expect the cholesterol level to be less than 200, and the at the borderline or at the risk category, the cholesterol level raises from 200 to 239, and if it is more than 240 milligram per deciliter, that is the dangerous level of cholesterol. Similarly, the bad cholesterol, we expect it to be less than 100. When it is between 100 to 159, we say that it is borderline or at risk. And if it is more than 160 milligram per deciliter, it is dangerous. Similarly, the good cholesterol or the HDL cholesterol, the higher the value, the better. If it is more than 60, it is very good for your heart. If it is between 40 to 59, it is borderline. And if it is less than 40, the good cholesterol, then it is dangerous level of HDL cholesterol. So now what are the symptoms of this high cholesterol? तो अगर कोलेस्ट्रॉल ज़्यादा है, पेशेंट्स को कोई भी सिम्टम्स नहीं हो सकते हैं, या तो ऐसे सिम्टम्स होंगे जो हमको दिखाई देंगे, या तो ऐसे सिम्टम्स होंगे जो ज़्यादा कोलेस्ट्रॉल के वजह से, कॉम्प्लिकेशंस के वजह से हम देख पाएंगे. What I mean to say here is that high cholesterol can have no symptoms at all, or it can have few visible symptoms, or it can have symptoms of complications due to high cholesterol, like angina, shortness of breath, heart attack, stroke. All this can happen because of the complications of high cholesterol. Now, what are the symptoms or the visible signs of high cholesterol? So, the visible signs, what we can see when a person has high cholesterol is xanthomas. What are xanthomas? They are nothing but fatty bumps. You can see yellowish bumps or lumps like under the skin, especially when you see it around the eyes or around the joints, in the knee. You can see this deposition of cholesterol. Then you will see corneal ulcus, that is a ring which appears around the cornea of the eye. And you can see this xanthomatous deposits in the tendons, like especially in the knuckles, in the knee, or in the Achilles tendon. So that is called as tendon xanthomas. So now let us see what are this xanthomas. So what are xanthomas? Xanthomas are nothing but these waxy substances which appear as lumps or bumps under the skin, especially around the eye, in the elbow, in the knee, in the hand, in the buttocks. So this can be caused by various other causes other than increased cholesterol, like you have diabetes, certain cancers, liver disease, hypothyroidism. All can also cause increased deposition of this substance and can cause xanthoma or xanthomas. So here you can see the xanthoma. These are the deposition of cholesterol which is happened here around the eyes, giving it a yellowish hue. Same thing here also. Here you can see this slightly yellowish deposition of this cholesterol crystals, which have given rise to this bumpy appearance around the eye. Similarly, you will can see this corneal arcus or arcus senilis. This is a white, gray, or a blue ring that appears around the cornea, and it is caused by deposition of these fatty substances like cholesterol. Here you can see clearly this is the clear area around the cornea, and this is due to the deposition of cholesterol. So sometimes this cholesterol deposition occurs in the tendons and they appear as these bumps or nodules. So they can be one of the sign of this dyslipidemia. Usually in this familial hypercholesterolemia, we see this kind of xanthomas in the tendons. So here also you can see this xanthomas which have occurred in the tendons. Now, sometimes the patient can have complications because of high cholesterol, like when the fibrofatty plaques, they obliterate the blood vessels, they can cause less blood supply, and they can cause these symptoms like high cholesterol is a risk factor for angina. What is angina? It's a type of chest pain, and when this occurs, whenever the blood flow to the heart is reduced. And why the blood flow to the heart is reduced? Because the blood supplying the heart, or the arteries which supply blood to the heart, they are narrowed. Why they are narrowed? Because of increased cholesterol. How they are narrowed? This cholesterol, when it exceeds a certain level, it will block the vessels, and when there is no enough blood supply, when there is no enough oxygen, the blood flow to the heart is reduced and the heart cries, and that pain is called as angina. So this high cholesterol, it can cause angina because of various causes. Like when you have the increased level of LDL cholesterol, that is the one, the bad cholesterol, that is the one which actually narrows down the arteries, and the buildup of cholesterol and other substances, they will form these plaques, fatty deposits, and they will reduce the blood supply. So patient can have this pain whenever he's exercising, or he's doing any strenuous activity, or he's having an emotional breakdown. Then the patient can get this kind of a pain, because the blood supply or the demand to the heart also rises, and patient can have this kind of an attack. Other risk factors for this kind of a chest pain would be if a patient is having high blood pressure, patient is smoking, patient is obese, overweight, he's physically inactive, he's having an unhealthy diet, and if there is a family history of early heart disease, all this can also lead to angina. So patient usually complains of chest pain, especially when he exerts, he has done some high intensity exercise, or he has trained himself, he was walking an uphill, suddenly he will get this kind of a pain, and he will feel a tightness around his chest, something very heavy has been laid down on his chest. He might have difficulty breathing, he might start sweating, he might feel nauseated, he might feel vomiting sensation. All these are the signs of angina. So these will tell us that the patient is having a dyslipidemia. So that was when the blood vessels of the heart were involved. Now what about the blood vessels in the brain? So this fibrofatty plaque deposition can also occur in the blood vessels of the brain. So when this occurs in the brain, it can lead to symptoms like TIA. What is TIA? Transient ischemic attack. So here what happens? The patient has a transient attack. It lasts for a very small, short time, like a transient attack. So the patient will have, for some time, he will have confusion, he will lose balance, he will have dizziness, he cannot speak clearly, he cannot, his vision is blurred. But after some time, when the blood flow is restored, he will be okay. Suppose if this blood flow is completely stopped, patient will have stroke or paralysis, because the blood flow is completely stopped, the end organ damage occurs, the muscles and organs are going to suffer because of less of oxygen, and they will die. So that is why there would be paralysis. So there can be stroke, there can be transient ischemic attack whenever the vessels of the brain are involved. Next would be the peripheral arterial diseases. Here what happens is, the blood vessels of your limbs, upper and lower limbs, can be involved. So this when the blood vessels of the limbs are involved, patient will have pain when the patient is walking, when the patient is climbing stairs, when the patient is running, he will experience a very severe pain, that is called as claudication in his limbs, in his buttocks, etc. So this also occurs because of the deposition of the fat or the cholesterol in the blood vessels. Sometimes this fibrofatty plaque can rupture, can dislodge from this place, and can get lodged into other blood vessels and can block those blood vessels also. So all these are the complications or signs of high cholesterol. It could be visible signs like xanthoma, xanthelasma, etc. Or it could be the signs of complication. Patient having angina, patient having claudication pain, patient having transient ischemic attack. Or there could be no signs and symptoms at all. So the only way how we come to know is by frequent monitoring to assess the risk factors, to see what are the risk factor for that patient, what are his symptoms, and accordingly monitoring the patient. So these were few of the symptoms which can come when the cholesterol levels are high. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.